Hello, everyone, and thank you for joining us for this session. I'm Ebru Ilhan, and I'm part of the Women's Forum editorial team. I'm very pleased to welcome you to A Pitch for Inclusion, the care economy. If not now, when? And to set the scene for us, I'm delighted to hand over to Khara Jabola-Carolus. She's Executive Director at the Hawaii State Commission on the Status of Women. She'll be delivering a powerful message on the care economy and a feminist recovery. Over to you, Khara.
Aloha, my name is Khara Jabola-Carolus, and I'm the Executive Director of the Hawaii State Commission on the Status of Women. We are a feminist government agency at the state level in the U.S., and we are really honored to join you from Honolulu for the Women's Forum Global Meeting 2020. I am so excited to talk to you a little bit about our Feminist Economic Recovery Plan from April 2020, which was a plan to transition Hawaii away from an economy based on tourism, luxury development, and militarism, which was not serving our local population, and in particular, women and working women. So we wanted to take this moment to organize women across the state around a plan that works for them. And there is really no better moment to talk about what women's labor and leadership can bring to the table in terms of a just and humane economic system. I'm sure many of you are still feeling the feels from the outcome of the U.S. presidential election. I know that I am. And there is a lot of conversation around the importance of parity, diversity and inclusion, representation of women of color in particular, in positions of power right now. And Hawaii is no stranger to many of the firsts that other states across the U.S. are celebrating at the moment. We were the first state to send an Asian American woman to Congress. We were the first state to send an immigrant woman to Congress. And we've had all-female delegations to Congress sent 3 times. We've also had a female governor of our state. We understand and embrace women's leadership, but at the same time, we don't romanticize representation in Hawaii. And that's, one really poignant example of this is the fact that our female governor almost eliminated our commission, so the Commission on the Status of Women. We know that if our leadership, regardless of gender identity or sex, regardless of what it is, if they are not committed to feminist principles, then we have no assurance that our future will be any better than a future controlled and determined by men in power. So this is really important to us and part of what catalyzed our Feminist Economic Recovery Plan. So at the outset of the COVID-19 pandemic in Hawaii, we wanted to really model what it could look like for government to be feminist in practice, be collaborative, be transparent, not harbor this sense of hostility to a public that was really being punished by the indirect impacts of COVID-19. And so we created a collective group, our Feminist Economic Response Team, which was pulled from cross sections of sectors across Hawaii. So we had a feminist economist, we had students, we had public health experts, we had civil rights experts, lawyers, and also service providers and community organizers. So it's really important to have different perspectives because we know that a lot of times government doesn't really value the voices of the community or have the trust that an organization like us, an agency like us working with women every day might have. So this is a huge asset in terms of being able to see down the road, understand how gender inequality might play out through the crisis and how we can prevent that to ensure that we are strong enough to weather this as a society. And so it's available on our website. I encourage everyone to go forth with their own plan. And I think that this moment, more than anything, is about taking an intersectional and internationalist perspective on making sure that we can use this crisis not to have gender equality derailed, but actually strengthened through the momentum that we're building together around a feminist future. So thank you so much for having us, and we hope that you have a great rest of the panel. Mahalo nui.
Thank you, Khara. That was really inspiring. We will now move into a discussion on supporting health innovation and essential worker health. Before I introduce our moderator, a quick reminder. To follow and engage with the session on social media, please use the hashtags Women for Health and WFGM20. We invite you, our audience, to also ask your questions to speakers in the chat during your session. If possible, the moderator will look to bring some of these questions directly into the discussion. And now, it's my great pleasure to introduce Monisha Banerjee, consultant at Spencer Stuart. Monisha, the floor is yours.
Thank you very much, Ebru. Well, I have to start by saying it's a pleasure and honor to be moderating this session with such an impressive group of women to discuss a topic that is very close to our hearts, both on a personal level, a deeply personal level, but also from a professional perspective. Today's discussion is going to be about the impact of the pandemic on women. We're going to put a spotlight on women, particularly in healthcare, across the whole ecosystem, both in terms of those at the front line, delivering care to patients, but also women in healthcare from an innovation standpoint as well. We'd also love to stimulate a discussion around how health systems, businesses and institutions can really work collaboratively to support and sustain rapid innovation and essential work that societies and economies desperately need. So without further ado, I'll introduce you to our fantastic speakers, starting with Karima Silvent, who is the Global Head of HR for AXA, the global insurance company, who was a rising talent at the Women's Forum in 2008. We also have Rafaèle Tordjman, who is the founder and CEO of an international venture capital fund, Jeito Life. We also have Catharine Bowman, who is a 22-year-old Canadian scientist and vice president of the Alberta Lymphedema Association, and also a rising talent this year for 2020. So a warm welcome to all of our speakers and the audience. We'll kick off with the first question just to open up the discussion. So would love to start a discussion around how the pandemic, in your view, has impacted women in healthcare, including those at the front line, as well as those in innovation, and very conscious that the three of you bring very different viewpoints and angles, given your roles. So would love to start with Karima.
Thank you, Monisha. And as you said, this is a topic that is dear to many of us, and maybe I can share first my background and why I care about this topic. And as you said, I am the HRD of AXA, which is a global insurer. Health insurance is at the core of what we do, but what people may not know is that we also service health. We have care networks. We operate hospitals and care networks in some countries like Mexico and Egypt. We also operate health platforms like telemedicine or holistic health platforms across the world, and notably thinking about Europe, but also Asia, Hong Kong. And also we do research on health and women health because this is a topic which is absolutely critical for us. And by background, I've spent 10 years, I would say, on the ground working in hospitals and elderly care. So this is a topic which is very important to me. To your question, I think we've all read many articles and we've seen the numbers. 70% of the people being in the front line, working in the healthcare services, are women. And this is even higher in some geographies. And this is even higher, for example, when I'm thinking about elderly care. And those women have also, all the duties around household, caregiving in their personal lives. So to a certain extent, they've paid a hard price to this pandemic. And my biggest concern, I would say at the moment, is truly that when we see and we are observing mental health burden and issues, that we see burnout happening in those sectors, that we shouldn't and we must not have more women dropping out from the workforce, I would say, especially in healthcare, especially in research or innovation in health. So I would start, I would say, with this very important element.
Catharine, would love to hear your views as well on that point.
So kind of, building on what has been said, of course, the majority of our workforce being women, have certainly witnessed in colleagues and conversations of the impact that, of course, the physical symptoms are having upon people, but, as was said, the psychological component as well. Just the other day, I was listening to a young nurse give her perspective on what it had been like working on the front lines, and she actually contracted COVID and talked about that experience for her. She was experiencing a feeling of guilt because she wasn't actually able to continue kind of fighting on that front line with her colleagues and her co-workers to continue to serve in the way that she had beforehand, and not from necessarily just I guess an acute symptom standpoint, but also when we look at the prolonged effects that this can have on people, both in terms of mental and physical health. She talked about that fatigue that was prolonged and really not being able to get back in there as she would have liked. So, I think from a policy standpoint, it really speaks to how we need to approach this issue holistically. It's not just about the signs and symptoms, it's about the experience of these men and women who are working for us on the front lines.
Rafaèle, over to you.
Yes, I would say hello, first, it's a pleasure to be there with you and discuss this very important topic to my heart as well. Women in healthcare and for healthcare. I would start first by saying, indeed, unfortunately, this pandemic crisis has reinforced all the gaps and all what is not helpful for getting healthcare access for women. The fact that women are indeed in the front line doing, putting them on the side, or others putting them not on the as equality in terms of role and giving the same chance to these women. So just I'm stepping back in terms of how I see how we could help here. It's by innovation. It's not only because it's what I'm trying to do. More innovation in healthcare. Is that I realize that first, if I may, I'm a physician, so for me, patient is the most important. I'm a hemat-oncologist, so in oncology. But then I realized through science, but also through the investment, that women are key for making progress for healthcare. Not only they are the most involved in families to take decision, taking care of the two extreme age of the life, children and elderly people, but also they are key to make progress in healthcare and innovation. And it's why, in addition to, as you mentioned, Monisha, in terms of fun, more than 10 years ago, I founded an association of women named WITH, Women Innovating Together in Healthcare. Very small compared to, obviously, this Women's Forum, but it's the goal here is that we are all together from the whole ecosystem, actually, from the science to all kind of stakeholders you could think of, including association of patients, including all what you could think of to try to make progress for patients, but also for prevention, obviously. And the women are a fantastic accelerator. So I would say that the best way to try not to get all the impact of this crisis or for the future is to get women on the front line for innovating for obviously the world, but primarily for women.
And I'd love to pick up on one of the points that was made, particularly around mental health, because certainly through the conversations we're having with various leaders across healthcare is that there needs to be an even greater spotlight on mental health, particularly sort of coming out of the pandemic, given the additional responsibilities that women often tend to have, childcare, you've got aging parents, you've got the added layer of stress, from a financial standpoint as well today. So keen to hear what you're observing within your own organizations, but also stakeholders that you're engaging with, and solutions to some of these challenges that are emerging.
Maybe I can
Karima,
start. Yes, please. Because honestly, on this topic of mental health, this is the shadow pandemic behind the pandemic. And that's truly my belief. We don't speak enough about the mental health topic. And Catharine was mentioning the entire experience. And today what we observe through data is that mental health issues are increasing in the general population, and especially for women. We've made some studies. Totally, you've seen the studies that have been mentioned yesterday at the opening of the Women's Forum, which show that, and across geographies, because it's a study across 8 countries, 8,000 people, 51% of women who have been surveyed report that they have an increase of stress and anxiety. And this number is higher for women than for men, for all the reasons that you've just mentioned, Monisha. So it's really a shadow pandemic. I do believe that we need to care and to have real action towards it. We have also data through our telemedicine platform, which show that because telemedicine has been, I would say, increasing, and the support that is being given to people across geographies is increasing, and women are, for 60 or 70%, the ones calling for telemedicine. And psychologists are the second reason why telemedicine platforms are called. And I found these figures very striking, because behind those calls you have, as you said, stress, anxiety, and also the financial burden element, which is increasing at a very high level. So in my view, this calls for more action on mental health for all, I would say, all actors, and also on prevention, because mental health is, it's linked to also physical health, as we all know. And the last element that we observe is that women are stopping to do their regular checkup. You have this incredibly daunting data, which is around 40% of women who didn't go to their regular medical checkup during the pandemic, which I found absolutely scary. So prevention is critical. That's the reason why on our side, we've decided to launch now a program for all our employees worldwide, which is a global program on health, both on prevention and mental health and care, with several pillars like digital checkup, medical checkup for all employees above a certain age, like employee assistance program with psychologists that people can call 24/7, like also education and awareness, because on mental health, and this will be my last point, the biggest problem is stigma, because people don't talk about it. They don't dare to ask for help. They don't dare to call the helplines. And because still in many countries, this is a taboo to acknowledge mental health. So I'm just sharing that experience. We have decided to act as an employer. We are acting as an insurer too, because we are developing several, I would say, on employee benefits, several products on mental health. I'm thinking about my colleagues in Asia, in Hong Kong, some mind health products. But this is absolutely critical that government, corporates, international organizations act more on mental health, because this is the next pandemic out there and the wave is increasing.
It's a really important point, and I'd love to come back to that. I'd also love to capture Catharine's views. Being in Canada, I know that you've got some interesting observations as well, particularly with regards to technology being an enabler to support women, well, not just women, but people in general with mental health challenges. But keen to get your views.
Certainly. Yeah, thank you. So I'd first like to very much echo what Karima said, where we have what we see as a shadowing pandemic with a lot of the mental health challenges that we're starting to see arise. And certainly from our standpoint, I can speak to kind of some of the structural changes that have been implemented and are being used within Canada in terms of, you talk about psychological support being available, both for our frontline healthcare workers as medical students. We can call 24/7 for this type of support, both for ourselves and for our families as well, which is, I think, great. Again, thinking about that holistic component of these aren't things that just affect the people straight on the front lines, but everybody who is potentially interacting with one another. In terms of the telehealth component here, it's really interesting looking at how we can use telehealth in telemedicine to provide that support to men and women who, of course, are able to access this type of platform. Something that we've also talked about is, as we move into kind of the future of healthcare and we think about things like telemedicine, how critical it is as policymakers and decision makers to ensure that we also don't create a new gap in care in terms of inequity of those who can and cannot access this type of platform. So thinking about different marginalized populations or individuals with unique social contexts, whether this is people experiencing homelessness. In Canada here, we also have very much remote locations with, say, differing internet access, people in different socioeconomic brackets who are disproportionately affected by things like COVID, and how critical it is that as we continue down this line of the future of healthcare in terms of telemedicine, that we ensure that we're also creating kind of these holistic and equitable approaches as we continue to design our policy, both in terms of, I guess, technological advancement and innovation, as well as an innovative mindset as we approach our policy. Mm-hmm.
So I'd love to take the opportunity to pivot into, and this sort of segues quite neatly into innovation. And Rafaèle, I would love to hear your thoughts, in particular, being at the cutting edge of innovation from a biotech and broader healthcare context. Just to talk about the rapid acceleration that we've seen in terms of innovation over the last 9 months. I mean, telemedicine's been brought up. We certainly, from our discussions, see a ton of work being done within organizations around digital transformation, leveraging AI, biotech innovation. How do we make sure that women have a seat at the table where decisions are being made? Because obviously there's a follow-on effect, for the future. So we'd love to hear your thoughts, Rafaèle, on that.
Just before that, that's related to the previous question, but also to your question, I would like to insist on the topic of prevention and mental health, and maybe we could put the two together, because I think we should make even more efforts to prevent this mental health problem in women, having groups again, prevention. But back to prevention, why? Because obviously this crisis is terrible in terms of prevention, not only for women, but even more for women. So first, how many diseases are not treated because everyone is focusing on COVID in hospital because of the contagious aspect of the COVID, and you have kind of a future big issue, health issue that is coming, and there are some campaign, marketing campaign from some pharma for breast cancer, for example. Breast cancer is terrible because already women in general they come late at the hospital or to see their doctor because always taking care of others. But here with this COVID crisis, then it's even worse. And there's a campaign from one pharma that I like very much saying, deconfine your breast. So I think it's just an example. So yeah, I wanted to emphasize this prevention issue. And here the innovation has a very, very important role. As you said, it's in terms of digital health tech. Even though at the center of solving this crisis, it is a treatment. We will be out of this crisis because of a new therapeutic, either a vaccine and or some treatment. And nevertheless, all what is going together with treatments is very important, particularly for getting access for women. And what happened is that the pharma and healthcare industry took a lot of delay in terms of using AI and other technology, even though healthcare is the best discipline to use this technology because you have so many data published. So it's now the time to catch up, and the good thing of this bad crisis that we have to, and we have to be sure indeed that women are in the center of this innovation. As I said earlier, with convinced and also by facts that women are an accelerator, we should be there. We should be there to promote what we are trying to do with not only with association, but also actually starting with helping young women in universities by a foundation that is there to address problems more of health that are without business models, that are not profitable right away, and to be sure. And then you have this phenomenon that we could see very interesting, including from the fund, because we are in the fund of women in the team, is obviously, women will attract other women. So if we are in the center of innovation, therapeutic and others, we will be sure that women will be served for sure.
Catharine, would love to hear your thoughts around female entrepreneurship and inspiring young women.
Certainly, yeah. So coming from my background, both in terms of my medical background, but as a scientist and young entrepreneur, so I began innovating when I was about 13, 14 years old. My mother developed an incurable disease of her lymphatic system. And unfortunately, there was no drug treatment, still to this day, no drug treatment for her disease. And so I watched my mother really struggle through that. And so that was kind of my introduction to entrepreneurship as a 14-year-old, promising my mother I would cure her or treat her one day, and began doing so, building research proposals when I was 14, 15, and within a year built a national collaboration of scientists and clinicians to pursue this project across Canada. And when I look back at my journey, I think it's interesting to read about, I think, different investment models in terms of how we can support young females who are of an entrepreneurial mindset. Certainly, we can kind of work with them at the undergraduate phases and with startups and as they're getting going in that regard. But I also think there's certainly an important place for investment in people who are, in their early teens, different development programs. They say by the age of 4, we're starting to think about whether our interests are lying, say, within a STEM-related field, science, tech, engineering, and math, or elsewhere. By the time we're 13, we're starting to think about STEM-related careers or otherwise. And so I look back and think to myself, I had access to different youth development programs like science fairs. I actually used the science fair as a platform to start working on this kind of national research effort that we have still going to this day, and how important that was in terms of my development, both as a young scientist, but in terms of my confidence as a speaker, a collaborator, and building my network, all of those different aspects. And then I think also tying in that piece about, as female leaders and mentors, what can we do to foster and nurture someone who is clearly driven and passionate about making meaningful change? And I think the one thing I noticed most certainly with my mentors is they didn't necessarily look at my age as an indicator of whether or not I would be successful or capable. It was about my potential and drive to make a difference. And so that would be a big piece that I would hope people are able to take away, is as mentors, to not place your mentees into a category or a box and assume that you know what their ability to make change actually is because they're a certain age or another category, right? So that's how I would bring an answer to that question.
Such a good point. We need to sow the seeds early. So we've got an interesting audience. We've got a couple of audience questions. Thank you so much for those who are sending questions in. I think the mental health challenge, I think, is clearly one that our audience is observing. So there's one question which is, what HR strategies are being put in place by companies today that you're observing to try and mitigate some of these challenges. And Karima, I think you mentioned, I think you touched on this earlier, but as you look at the broader landscape, are there any organizations, I mean, are there different methodologies that people are adopting right now that you'd like to comment on? And Rafaèle, you as well.
Yes, absolutely. Yes, absolutely. I think this is a new topic, and some companies have invested more than others into research and action. But I think we start to have a good level of practice around mental health. And the first one, because I've also seen the questions, is around how do you break stigma? Because that's the most important. How do you encourage people to talk about it? And so our experience so far at AXA is that we have set up first huge communication campaign to encourage people to talk about it. You know, how are you campaigns, just to check in, because sometimes we don't even take the time to ask people how they feel on a daily basis because we rush into what we have to do. So we have managed and increased those campaigns. We have also encouraged people and leaders in particular to be accessible and vulnerable. It's easier when a leader, I have been overstressed during that period as a leader of this company. And I think sometimes in the organization, people don't dare to share their mental health issues and burden because they fear in some companies that this may be taken as a performance topic. It's not a performance topic at all. So I do believe that breaking the taboo and the stigma and talking about, so we've done webinars, trainings, and we'll have, and the second element is really reinforcing the understanding and the knowledge. Once you understand how body and mind work, you can yourself better understand what's happening in you and better read what's happening in colleagues. So what, for example, currently we are doing at AXA is that we are cascading a training for our 10,000 managers across the world, which is around mental well-being. We've built it with doctors and with really simple tips around, okay, how to, and also how to prevent, what's the value of nutrition, exercising, getting out, social contacts. Because nowadays, around this shadow pandemic, the biggest element is isolation, because we are all in our respective, homes, many of us locked down. And this is creating a gigantic amount of isolation. And when you are isolated, you don't put things in context. You overestimate elements. You procrastinate because so you need to have some tips to break that isolation. So I think companies and governments can do better to break that stigma and encourage people to, I would say, take advantage of the resources out there and talk about it, really talk about it.
Rafaèle, you want to comment?
Just to add a suggestion for companies, as we have more and more questionnaire to do about environment and ESG, CSR, we should get a part on, of course, for women now more and more, and the salaries, etc., but also for the mental health. I mean, we should get a score per company of how they take care of that for prevention, but also follow up, and just to speak about that. Maybe the good thing of this crisis, with a lockdown, confinement, and isolation, is then to take advantage of that, to put some measurement in place, and the questionnaire, and having a kind of AAA for companies that are doing very well for that would be good. Because how to be practical, I mean, AXA is great because it's a very big company. You have, I don't know how many employees, so already you have an impact, and then each of them hopefully has an impact around them. But we should do broader than that.
Absolutely. Now, obviously, with health systems being under immense pressure dealing with the pandemic, and these challenges that we've been talking about are very complex. How do you see governments, corporates, health systems, and other stakeholders as well coming together to support women better? And it could be, around innovation, it could be around education and just broader support. It might be financial, but just keen to hear your thoughts around how we can take an interdisciplinary approach to try and solve some of these challenges. better equip women, coming out of the pandemic. So Catharine, do you want to start?
For sure. So when I think in thinking about this question, there's kind of two lenses that I would look at it through. And the first is from, of course, a healthcare design kind of infrastructure in Canada, having publicly funded healthcare, changes that we can implement in terms of inclusive design of spaces, but also within our own teams, thinking about more kind of the corporate side of things, anywhere that you'd be building your team. From an inclusive design, so we've seen this at our university and our hospitals here, looking at ways in which we have, unintentionally potentially created barriers for women who are working, whether that's in healthcare or otherwise. There's a discussion that was ongoing about, our young female residents, medical residents, having to pump breast milk in on-call rooms or in different kind of finding these side spaces because we didn't have a designated space for them to be able to address this component of their care need. The other component is, of course, as we're all operating in a crisis currently, looking at these additional levels of stressors and being able to mitigate that, things like including, gender inclusive bathrooms so that someone doesn't have to feel that added distress when either looking at, do I go into the men's or the women's bathroom? Those kind of components where we're really looking at how we have designed things and including different perspectives as we continue to go about redesigning the future of our workplaces and our workforces. And then the other side of things I'll touch on briefly is just looking at our team infrastructure. So I think we've talked a lot about professional development and the importance of professional development, but now we're in this kind of new experience that I think we have reaffirmed or have created visible our collective humanity and our human experience. And so being able to go back to our teams and instead of just focusing on, I think traditionally that kind of professional component, if we show up to work, we do our jobs, we go home and potentially continue working for several hours, being able to work with your team to understand their values, what they're bringing to the table, and how that aligns with the mission of the team overall. And so when we potentially enter into a new crisis, we're comfortable with each other and we understand our human components so that we can have efficient and effective collaboration as we address these kind of forthcoming crises and challenges that are going to be here for many years to come.
Rafaèle?
Yes, I would like just to rebound on what Catherine said now and also earlier in terms of obviously education, but also helping young women. And it's what you said, Catherine, it's obviously when you have the potential, let's not look at the age, it's the other way around. We should help young women to save time, to accelerate them, because we have as older women than you, we have lost time, and we would like to communicate that and help young women again to be in a position to help then others early on. So that's one comment about the age, and it's what we are trying to do with the foundation beyond the width is to help younger women to in their project and their innovation for the whole healthcare. So that's one comment I wanted to make. But please.
And maybe Monisha on this question, because you had earlier the question on leadership and women leadership, on which I would like to come back a bit. I do believe that, and I know this is being discussed at the Women's Forum, which is it's not the fight is not over, and we shouldn't let this crisis. Have society and corporates moving backwards in terms of positioning of women leadership and women leaders, be it in healthcare, pharma, biopharma, etc., but also in all the industries. So I think this is a very first important element, which is we still don't have enough women at top positions in many industries, and the fight is not over. And I do believe this is also one condition for having women more at the center of the recovery policies moving forward. And so for me, that's a very important conclusion, which is this battle is not over. And I think governments can do more. corporates can do more. As an investor, we have recently teamed with other investors to create what we call the 30% Investor Club, where we say that as an investor, we will play our role as a shareholder with, I would say, asking the companies in which we invest to go towards having more women at leadership positions. But I think, society and governments in general, we need to continue that battle, which is more women at leadership position in technology as entrepreneurs, because that's where we will, at the end, have a more equal world, and also, which is very important for also the next generation. So I'd like to finish with these very basic points, which is an important one.
It is such an important point. It is probably one of the most important points, I think, in all of this.
Yes, there are some numbers, obviously, the fact that only 30% are in healthcare, are in a leadership position, and only, 13 as a CEO or at the C level. So that's still a lot of work to be done. I fully agree with Karima, and that was actually the Secretary General of United Nations who early on in the crisis, COVID crisis in April 2020, said that first be sure to get these young girls and young women, facing this type of crisis. We need first to get more women at the leadership position. It's how we will succeed for sure. We agree.
Absolutely. And also just wanted to say that obviously with technology at our fingertips now, leveraging technology to work flexibly is something that we're certainly observing. So I think, we should be using it to the max. Just one last question. I guess it's a closing question because I'm conscious of the time. In one word, what have you learned from the pandemic and what can we build on? Literally just one word. Would love to hear your views. Karima, do you want to start?
One word, difficult, but if I have one word, it's better. Better world. So that's the one that I would keep.
Rafaèle?
I would say we need to, so it's not one word, but counting women for women to count.
Catharine.
Absolutely. And mine would be, I think we've learned a lot about courage and needing the courage to make decisions together, be there for one another. And, I figuratively say, walk out of the flames on fire to be change makers for today and for tomorrow. So certainly that front.
Fantastic. Well, thank you so much for what's been a really engaging discussion on this very important topic. It's hugely appreciated.
Absolutely. Thank you very much.
Thank you. Thank you so much.
Thank you.
And a big heartfelt thanks from me too to our wonderful moderator and speakers. And big thanks to our audience for joining and for sharing such wonderful questions. We would now like to welcome you to join the next set of sessions. You can just go back to the live page on the Women's Forum. And if you still have any thoughts, please tweet using the hashtag Women for Health. Thank you so much.